He'll spend 3 hours fixing the lawnmower, watch YouTube videos to diagnose a strange noise in his truck, replace a leaking faucet without calling a plumber. But when it comes to his own health, it'll be fine. It's probably nothing. It'll go away. Doctors don't know what they're talking about. Sound familiar? If you've ever wondered why so many men avoid going to the doctor and what their partners can do to encourage them without turning into a nag, this video is for you. I'm Becky. Welcome to my little corner of the internet. I'm a wife, daughter, aunt, a friend, a mentor, and a godmother. I have a lot of men in my life who I care about very, very much. Statistics consistently show that men are less likely than women to seek preventative health care. Many delay checkups, ignore symptoms, and wait until a health problem becomes serious before seeing a medical professional. This isn't because men don't care about their health. The reasons are often more complicated than that. So let's take a look at what's really going on. Many boys grow up hearing messages like, be tough, walk it off, don't complain, real men don't show weakness. I heard my father-in-law say every one of these to my husband, and my husband was in his 50s. I am certain he had been saying these things long before I entered the picture. Over time, those messages can shape how some men respond to illness. Instead of asking, should I get this checked? They ask, can I still function? Can I still go to work? Still mow the lawn? Still provide for my family? They may convince themselves that everything is completely fine. Unfortunately, many serious conditions don't become obvious until they've been developing for months or even years. Sometimes avoiding the doctor isn't about stubbornness. It's about fear. Fear of hearing bad news, fear of losing independence, fear of surgery, fear of medication side effects, fear of being told life has to change. For some people, not knowing feels less frightening than finding out. But delaying care doesn't make a problem disappear. It only reduces the opportunity to treat it early, and that's when many conditions are easier to manage, like type 2 diabetes, high blood pressure, cancer, and heart disease, conditions that we know contribute to early mortality. Life is busy. Work, family, bills, kids, elderly parents, responsibilities. Many men place other people's needs ahead of their own. They'll take a child to the pediatrician immediately, encourage their spouse to schedule a checkup. They'll drive their parents to medical appointments. But when it comes to themselves, I don't have time. I've got to finish this project first. Maybe next month. Months become years, and routine prevention gets replaced by an ambulance ride to the emergency room or a major surgery followed by months in a rehabilitation facility. Cost is absolutely a factor. Here in the good old US of A, we have I'll be polite, challenging healthcare system. It's challenging for both patients and practitioners, by the way. The cost of health insurance, co-pays, medications, and treatments, those costs are obnoxious in many cases, especially if you've got something big happening. And this is why preventative or routine care is especially critical. Catching problems early could mean a simple medication or a relatively basic treatment. If you wait too long, things can be far more complicated. Another thing to think about is that we often focus on specific symptoms, like a persistent ache or some type of acute pain. We try to treat that symptom with over-the-counter medications without considering that perhaps that specific symptom could be pointing to something bigger. Your physician is trained to pick up on those things in ways that we lay people are not. If you've watched any of my other videos, you know that my channel is focused on how I've managed my type 2 diabetes and my lifelong struggle with weight. Type 2 is a huge problem for both men and women, but it's absolutely treatable. And the key is catching it early and taking it seriously. Often there are no signs of type 2 early on. I've seen what happens when type 2 goes untreated over time, and it's sad. And I also know people who've had type 2 for decades and are living beautiful, active lives in their 70s and beyond. And it's because they plug into their healthcare team and follow their treatment plan. The irony is that the appointments many men avoid are often the quickest. A blood pressure check, a cholesterol test, blood sugar screening, cancer screenings based on age and risk, vaccinations. These simple visits can detect problems long before any symptoms appear. Finding a condition early often means more treatment options, better outcomes, and far fewer complications. Preventative care isn't about expecting something to be wrong. It's about staying healthy enough to keep doing the things that matter most well into your senior years. If your partner avoids the doctor, constantly arguing isn't going to be effective, trust me. Neither is shaming. But instead, try understanding what's behind the resistance. Ask questions. Is there something about going to the doctor that worries you? Listen without immediately trying to solve the problem. Offer practical support. Help schedule the appointment. Many people have no idea how to schedule a doctor's appointment, by the way. Go with them if they'd like company, or offer to drive if they're nervous. I know one older man who quit going to his doctor and his family didn't understand why. Turns out that his doctor moved to a different location, and it was a longer walk from the parking lot into the clinic. And this older man was having a lot of hip trouble, and he was afraid he wouldn't be able to make it into the office. So his son and daughter-in-law offered to start taking him to his appointments, and they brought him into the office in the clinic's wheelchair, and that solved the problem. So sometimes reducing the obstacles is enough to make the appointment happen. Another helpful approach is focusing on what matters to them. Instead of saying, you need to go to the doctor, try something like, I want you healthy enough to enjoy retirement. I want us to grow old together. Our family needs you. Your parents need you. Men are often highly motivated by protecting the people and the things they value, rather than by fear alone. And if they do decide to make an appointment, acknowledge the effort. Positive reinforcement is often more effective than criticism. If you're watching this and you've been putting off a checkup, here's something to think about. Taking care of your health isn't a sign of weakness. It's a responsibility. Change the oil in your car, don't you? Service your furnace? Replace the batteries in your smoke detectors? Your body deserves at least the same level of care. Getting checked doesn't mean something is wrong. It means you're giving yourself the best chance to stay healthy for the people who depend on you and for yourself. The strongest thing you can do isn't ignore the symptoms you're experiencing. It's facing them. Courage isn't pretending nothing's wrong. Courage is taking action before a small problem becomes a big one. One appointment, one conversation, one decision, one set of labs. It could change the course of your health and maybe even save your life. If you found this video helpful, please give it a thumbs up, subscribe, or share this with anyone you believe could benefit from it. And I would love to hear from you. If you're a man, what's the biggest reason you've ever delayed seeing a doctor? If you're a partner, what approach has actually worked? So please share your experiences in the comments. And you never know, you might help someone else take that first step. Thank you so much for joining me. Have a great day, and I'll see you next time.